A year ago, I didn't even know what the vestibular system was. What I'd like to share with you today is what little I've learned, not only from this class, but talking to my ear, nose, and throat and physical therapist. So the outline for this presentation is to describe what the vestibular system is, what are some major symptoms that doctors look for to help determine, what is the testing used to diagnose, and then a couple of examples of how you might apply this knowledge. This picture is looking at the inner ear, and you can see on the orange arrow that's pointing in, that's where the vestibular system is. It's inside the inner ear, and it provides information to the brain about the head. And the information helps you have a sense of balance. The vestibular system can become impaired. So what are some of the symptoms that doctors look for? I found the Vestibular Disorders Association based near my hometown of Portland, Oregon, and there are 12 major symptoms that doctors look for. I'm not going to read all the description of these 12, but I'll stop the recording on this slide and the following one so you can read through those. Once a patient has some idea that they don't have very good balance, maybe it's in their gait, the way they walk, doctors go about diagnosing it in several ways. They also use some of this information on your gait, in other words, how you walk, to look at other neurodegenerative diseases such as Parkinson's, Huntington disease, and amyotrophic lateral sclerosis, ALS. Another aspect of this study that included 30 adults was to utilize data collected via pressure sensors. So these pressure sensors were attached to the feet of the patients when they took walks out in the community. The data was first captured by this machine, Arduino Mega, and it was carried by the subject and then later transferred to a laptop. One unusual aspect of vestibular disorders are the crystals that are in the inner ear that become dislodged. Now, when I first heard about this from a physical therapist, I was very skeptical. It's like, well, if you see those little crystals in there, can you go in and dislodge them, use a little vacuum and suck them out? Well, you can't even see them. So then I'm like, okay, well, if you can't see them, how do we know they're there? So there are several things that we need to learn about that. They are tiny crystals. They're called autoconia. They come loose from the normal location in the utricle, a sensory organ in the inner ear. If the crystals become dislodged or detached, they can flow freely in the fluid-filled spaces of the inner ear, including the semicircular canals that sense the rotation of the head. Autoconia will occasionally drift into one of the SCCs, usually the posterior SCC, given its orientation relative to gravity at the lowest part of the inner ear. Here's the bad news. They are too small, and they can't be seen with an MRI or a CT scan. They range in size from 1 to 30 micrometers, which is about 1/847 of an inch. in one of the research articles that I examined, this first one by Xavier summarized a research study that sought to identify appropriate treatments once a patient had been identified with chronic vestibular disorders. The process of this study was to first complete a comprehensive initial assessment at the beginning of treatment, and the main areas of focus are determined based on the most debilitating symptoms for that patient. At the start of each week, a screening of complaints or symptoms was conducted. For each complaint, an evaluation is performed and a treatment is adjusted based on the results. The figure below is a part of an example from the article, and it just illustrates what their process was. On the left side, symptoms are reported. In the middle, indicators to look for. And then on the right side, an example of a therapeutic response that they would develop and use with the patients. The procedures used in this study to first of all determine if they had vestibular disorder are listed here. It's very comprehensive. Some were just forms that were filled out, like the health survey, the dizziness scale, personality tests, but then there was also the vestibular health questionnaire, which these authors have developed and as of 2023 was not published. And in addition, there was a series of instrumental examinations that included sensory organization tests from posturography developed by a company, Synapsis, included a specific analysis called sensory organization assessment. Thank you so much for listening. Here are my references.